Okay, so falling should be accepted as a natural part of growing old. Agree or disagree?
Disagree.
You disagree? Good job. Um, yeah, because there's ways to prevent it, and there's ways to make sure that you're being safe and being active, and that's why we're doing the program. So that does not have to be a true statement. Most falls cannot be prevented.
No.
Yep. So most falls cannot be prevented. You agree that that's true, or you disagree? That's kind of a wordy question.
It is, because
It can be prevented? Is that what you're saying?
Yeah, sometimes.
Yes. You're
Household, right. But out in the public.
Yeah. That's a very good point, too.
Perception. The depth of a step.
Yes, that's true. So that's why it's good to be aware of the things around you, like if there's rails or even two walls, using hands to use the two walls.
Correct.
Just being conscientious of each step, taking your time. Okay, good job. Reporting a fall to a doctor could lead to restrictions of my independence. Do you think that's true or not true?
Could go either way.
Yeah, absolutely. I totally agree with that. That is definitely true and not true, because you want to be able to report and feel that you can get the education on safety that you need and that your doctor's putting you in the right position.
Mm-hmm.
However, that it's true. They might take away something, saying that you can't do this or you can't do that, but it's for your good.
Truth.
So that can be true. If I report a fall to a doctor, he or she may think that I can't take care of myself. Do you think that's true? If you tell your doctor that if you report a fall, that they might think you can't take care of yourself?
Could be a piece of it.
Yeah. Yeah, definitely.
And then just wanted information.
Mm-hmm.
Yeah.
Yeah. So that too can be kind of an agree-disagree. Yeah, it just depends, because sometimes people who are falling really can't care for themselves and they might need the extra help. And sometimes people who are falling just need changes, like in their rugs, or they need to add railings, or they need to make some safety measures.
Excellent.
If I report a fall to a relative, he or she may think that I cannot take care of myself. How do you feel about that one?
Yes.
Yeah. Again, with that, it's just important to remember that when you do tell relatives, that most of them want to help, and they want to help keep you safe.
Mm-hmm.
So not to be afraid to ask for help when you need it. Okay, my doctor is a very busy person and shouldn't be bothered with my concerns about falls. Disagree?
We really do like it.
Hold on, Dad. Shh. Disagree?
Disagree.
Good. Yep. Like I said, your doctor's there. He wants to help you and help make sure you're being safe. And my nurse is a very busy person, and I shouldn't be bothered with my concerns about falls.
Disagree.
Disagree. Good job. Falling is humiliating. Like, do you think people get embarrassed when they fall?
I think it's more concern, why did this happen?
Yeah.
There was a reason for it.
Yep.
Was I not knowledgeable? Was I not watching?
Mm-hmm.
Perspective.
Yeah. Very good. Perspective's a huge part of the falling is humiliating. And I think that I fall sometimes and I get humiliated, But that's one of those, am I slowing down and taking my time? Am I wearing socks on carpet and running downstairs? And
Oh, is that true?
yep. All right.
Precautions.
Yep. So this says, stop. Did you answer agree to any of those questions? Answering agree to questions 1 through 8 could be a reason for not reporting a fall to your healthcare provider. By not seeking help or discussing the fact that you fell with a physician or nurse, you are denying yourself the chance to find out what really caused the fall. Knowing why a fall occurs is the first step in preventing future falls. Falls are preventable. Most healthcare providers will go great lengths to provide you with service that will allow you to stay safely in your home.
True.
True, true.